retina is no romance, and retina requires a lot of hard work, lot of patience, is a difficult specialty to master, difficult to practice. Honestly speaking, when we were residents, my choice was limited because retina was a difficult specialty. Also remember, the equipment available at that time was scarce. We used to have only indirect ophthalmoscopy, lasers and angiography, and even surgeries were limited kind of buckling surgeries only. And there were hardly any choices, believe me. So we had to go through a lot of hard work in our life. And I remember I did not have an indirect also, although I was a senior resident at RP Center, did not have an indirect. Let me tell you a small story. You see how I started learning retina. You see, I used to come on all Sundays. I will ring up my sister in charge of the ward, and typically we had 45 patients per ward at that time. And I will ring her up, please dilate all the patients, and I will take a borrowed indirect from my faculty and start doing indirect ophthalmoscopy in all the 45 patients, whether they were of any specialty. This is how I learned retina. Believe me, it took me weeks and months before I could locate a horseshoe tear or a detachment. So what I'm trying to say is, retina is no romance. It is all hard work, patience, perseverance and persistence. If you have that, believe me, then success is yours. What I believe is, in life, once you have a success, you start adoring that success. Because I believe success begets success. You start enjoying the moment once patient has a smile on his face by virtue of your interference, whether it is surgery, lasers or cryo. You see, I'll quote one or two instances where I had some gratification and which actually made me adore retina. Like you said, how do you adore retina? So I was operating this VVIP patient. In fact, I was assisting my mentor, and this patient was scheduled for a buckling procedure. So we did all the steps of buckling as nicely as we could do, and at the time of drainage of subretinal fluid, somehow the fluid did not come much to create a hypotomy, and we had to tie all those buccal sutures. So believe me, at that point my mentor had stared at me what has been done. So he in fact left, and my all seniors left. So only thing I did at that time, had a deep breath, remembered those Linkoff's rule that our job is to close all retinal holes. So what I did at that time was did 3-4 times paracentesis. Aim of doing paracentesis at that time was to reduce the pressure so that I can tie 3-4 sutures, and this is what I did and closed the case. And although my mentor told me you have converted an extraocular surgery to an intraocular surgery and blah blah, but believe me, next day retina was all flat, and that was one gratifying moment which raised my confidence that it is not necessary to drain all the fluid. And second case I still remember. You see, he was a police commissioner and I was doing a vitreous surgery for him. He had already been operated somewhere for a VR surgery. So he had come for removal of silicone oil, but he had a macular hole also. You see, at that time macular hole surgery was just evolving, and we hardly used to operate macular holes. So I did the silicone oil removal, and at that time we had just started using ICG for staining, and we did not have recourse to OCT at that time. So we prepared the ICG, injected ICG. Fortunately for me, I could tease away the ILM with the help of a diamond industrial scratcher, and couple of days down the line this commissioner had improvement in vision. So these are two instances, one of buckling procedure and one of a vitreous surgery, which gave me gratifying moments in my life. What I'm trying to say is that if you keep seeing all your videos, all your surgeries, and see other surgeries also, you will keep improving day by day, but never lose confidence. There is no radiant trait in me. I think all human beings possess some trait or the other. What is important in retina is your ability to see. Believe me, if you can see a detachment, if you can see a tear, or you can do a good endophthalmoscopy, everybody has the potential to achieve success in retina. So what is required is hard work and never say no kind of attitude. You see, you never shy away from work, whether it is 8 a.m. or 8 p.m. Keep assisting your seniors, keep observing them, because I believe observation itself is a big teacher. So whatever work is allotted to you, keep doing that. If you can see the retina, believe me, you can do it. And have this attitude in your mind, if I can see or I can do, so can you. And what is the difference between two of us would be patience, perseverance and practice. If you do, or if any resident does this or any fellow does this, believe me, he will do as good a job as Stanley Chang also. There are moments where you achieve success, there are moments when you may not achieve the desired success. So actually the key challenges which I faced during my learning phase of retina was not having my own equipment. Like I didn't, during my residency, even during my senior residency, I didn't have my own indirect ophthalmoscopy, and neither did I have my own lenses. So this was one challenge. So as soon as I became faculty at RP Center, so I used to insist that all fellows should have their own indirect ophthalmoscope. If they have to come to retina clinic, they should have their own plus 90 and plus 78 lenses, so as to do their proper posterior pole examination. The second challenge which honestly we used to face was this attitude of seniors. You see, at that time seniors were untouchable. Like nowadays, all the fellows and residents, they can easily approach seniors and ask questions, queries, and solve their issues. There was a gap. There was a gap between us and the seniors, and you had to have enough courage to talk to them also. And neither there were YouTube and Googles and all these computers to teach you. So these were the two challenges. I would suggest all the residents or budding fellows to go for it. Go for it. Believe me, you should learn to accept challenges. And also, you see, the job options are plenty, much more than cataract and refractive surgery. Although cataract and refractive surgery makes you rich very, very fast, but believe me, retina is one specialty which every practitioner wants to learn. Because today, none of the practice will survive for long if you don't have a retina consultant with you. So that is the beauty of retina. My wish to all these budding and upcoming retina surgeons says don't lose heart, don't let the fire go away, keep this passion alive, keep working hard, keep reviewing your videos and keep learning. All the best.